2.
Good evening, everyone, and thanks so much for being with us for what I think is going to be a very, very important town hall. We have three wonderful guests who are going to help us tonight understand what this pandemic and economic collapse has meant to the undocumented community. You know, I think as progressives, we all understand that the essence of what we believe in is the concept of solidarity, that we're all in this together. No matter what our color may be, no matter where we were born, no matter what kind of work we do, we are human beings and we are in it together. We also know that at this moment, our country and much of the world is going through an unprecedented crisis. Here in the United States, over 50,000 people have died of the coronavirus. At least a million have been infected. In the last 5 weeks alone, some 26 million people have lost their jobs, and I think that's a conservative number because those are people who are just officially filing for unemployment. Throughout our country now, I know in my own state of Vermont, but throughout this country, there are many people who have lost their jobs and are literally wondering how they're going to feed their kids tomorrow. We have people who are frightened that they don't have enough money to pay their rent, and they're worried about being evicted. They're worried about losing their homes, seeing their credit card scores go way, way down because they can't pay their student debt or their credit card debt. So we got a lot of pain in this country today. But I think one group of people who we have not focused on enough as a nation, people who are maybe feeling even more pain than other folks in our country, are the undocumented, because they come to us from a different position. They are often folks who are on the front line of our economy, exposing themselves every day to illness as they interact with other people. And yet, because they are undocumented, many of them are nervous about being able to go to a doctor, go to the hospital. At a time when we have worked hard in Congress to provide trillions of dollars to get out to working people in terms of expanded unemployment, in terms of a $1,200 check, in terms of other benefits that people in this country will get. The undocumented, despite the fact that they pay a lot in taxes, they're not getting those benefits. They're not getting. So how do you survive right now if you've lost your job, if you're nervous about going to the doctor or the hospital because you're undocumented, if you don't have a whole lot of money in the bank because you're kind of a low-income worker? What happens to you in the midst of this crisis? And that's kind of what we're going to be discussing tonight. And we have three great panelists who are going to be helping us answer some of those questions. Perla Silva lives in New York City and is a member of Make the Road New York. Perla recently lost her mother, who lacked health insurance to COVID-19. And Perla, we extend our condolences to you on your loss. And Perla has DACA status and has been very active in the immigration movement. We're going to hear from Perla in a second. Then we're going to hear from Kyle Bragg. And Kyle, as many of you may know, is the president of 32BJ, one of the maybe the largest local in the SEIU union. And the 32BJ has the more property service workers than any other union in this country. And he'll be talking about what his employees, his workers are going through in the crisis. And then we'll be hearing from Marielena Hincapié, who serves as the executive director of the Los Angeles-based National Immigration Law Center Immigrant Justice Fund. So let me begin with Perla and thank her very much for being with us this evening. Perla, from your experience, what is your family, what are other families that you interact with going through right now?
Yeah. Thank you, Senator Sanders. Thank you for having me here tonight. Thank you. Those are great questions. Very important. I think it's a great opportunity to finally speak about. The coronavirus has devastated my family and my community in the last 5 weeks. More than 30 members of Make the Road New York have died from COVID-19, and many more are struggling to get food. For my family, COVID first hit us financially. Everyone in my family, except for myself, lost their jobs. My brother is an elevator technician, my sister-in-law is a receptionist, and my father worked in a deli. So all of a sudden, everyone instantly became unemployed. And then the virus took away my mother, who not only took care of us, but many of the children in our community. We began to hear about the coronavirus early March. Since she had prior health conditions, my siblings and I begged our mother to stop working so that she could stay home and take care of herself and try to avoid getting sick. She stopped working around March 10th, but she still started to get the symptoms of the virus. And we listened to the advice of the doctors and the state and the city. Don't go to the hospital unless it's absolutely necessary. But eventually, it became too difficult for my mother to breathe. And we had to call the ambulance on March 23rd. When the paramedics saw her, they were dismayed at how sick she was and that she had not received any medical attention earlier. They took her to the hospital where she was isolated from everyone. We couldn't see or hear from her, and it's devastating. And this is exactly what a lot of our immigrant community has to go through. We know what it is. You get COVID-19, and it may be the last time that we see our loved ones. We were desperate to hear news from the doctor, and we understood the hospital and the whole system was overwhelmed. But it still was shocking that the only regular phone calls we were receiving were from the hospital's financial office several times a day, asking us how we were going to pay and for my mother's legal status. It was unbelievable, absolutely crazy what we were going through. Days later, after we finally got a call after calling many times to the doctor, she finally called us back and she told us she passed away. We were heartbroken, and my mother, a magnificent woman with an enormous heart and a giving spirit, she was so strong and she supported her family. She gave us all the education that she thought was needed for her kids. She even survived an immigrant detention with my father in the summer of 2018. We've been in shock ever since we lost her, trying to final the arrangements for her and figuring out how we were going to get by. My dad got sick. He was sick by then, and we thought that it was COVID-19. But he refused to go to the hospital. And then by the time that we got our first medical bill, he looked at me and he told me, see, this is why I didn't want to go to the hospital. It's unbelievable that he had symptoms. He's old. He's so much older than her, but he was afraid to go to the hospital because in the back of his mind, he knew, how are my family going to pay for these bills? And this is exactly what a lot of my brothers and sisters in our mixed immigrant families deal with. Every day when we go through something like this, we're afraid to get the medical attention. So our friends started a GoFundMe to help us take care of the final arrangements and support my family. Make the Road New York has provided us with so much support as well. But how broken is the system where grieving families like ours need to rely on a GoFundMe page? Mixed immigration status families like ours are being hit so hard by this crisis, but we have been excluded from the government support. Almost everyone is out of work. We have rent coming in, we have our bills coming in, but because some of us don't have a social security number, we are not able to get cash relief. A lot of our mixed immigration status families in the community, when I speak to them, they feel the same exact way. They know they're afraid to get unemployment. My brother has DACA, but he is afraid to get unemployment because he's afraid of public charge. And so is everyone else in our immigrant community. It's just so wrong, so wrong.
All right, Perla, I'm going to jump in. We're going to continue that discussion.
Yeah.
And thank you for your courage. And thank you for sharing your family's experiences. And be tough,
Thank you.
be strong, which you are, because you're going through
Thank
an
you very much.
unbelievably difficult moment. Let me go to Kyle Bragg. Kyle, as I mentioned earlier, is the president of 32BJ of the Service Employees International Union, the SEIU. And within Kyle's local, there are a whole lot of immigrant families. And I believe your union is majority minority. Is that right, Kyle?
That's correct, Senator. So thank you for having me with you this evening. My prayers and my condolences and sympathy go out to you, my sister Perla, and your families. What's truly unfortunate is that it's not a unique story, and that so many undocumented families are suffering under those type of tragedies. It really touched me to hear the struggles that you have experienced. But and again, the tragedies that you're not alone. There's so many hundreds of thousands of people who are suffering the same misfortunes and challenges that you are. I'm president of a union of 170,000 members, property service workers who are security officers, residential building service workers, commercial cleaners, higher ed janitorial services, schools services. And where majority, as Senator has indicated, immigrant population and people of color. And this pandemic has wreaked havoc, particularly on my home state of New York and yours, Sister Perla, and has taken away from us as a family close to 90 of our members have been lost to this pandemic. Our members, the union that they belong to is, for the most part, is the difference between their ability to access quality, affordable health care or not, which means it's the ability for them to survive or not. And now that we are suffering through this pandemic and losing members to layoff and furloughs, there's a large portion of that, I'm sure, as in any service industry, of members who are undocumented. And so the question is, what happens to those workers? Those workers that need equity and justice like every other worker, people who have been on the front lines providing these valuable, essential services to the public day in, risking their lives of their family, because once you leave your home and you go to secure a building or a school, or if you go to clean and maintain residential building where people live and depend on those services to keep themselves and their families safe, you risk your own safety, thereby risking the safety of your family. And so this is the challenges that we are faced with. And it is not fair that undocumented population of this country are constantly put in a situation where they are forgotten about and they are left vulnerable. They are living in the communities that are the most vulnerable, where they struggle to get clean water, where they struggle to get healthy food options, where they struggle to have affordable housing. This country should be better than that, and we have to be better than that. And there's no workers that should be left behind in this pandemic. This pandemic is not discriminating. It doesn't care whether you're documented or undocumented. It doesn't care whether you're black, white, yellow, green, whatever. And what it does is it wreaks havoc. And it wreaks havoc not only on the individual, but on communities. So if undocumented workers are living in communities and now they are furloughed or laid off and don't now have the protection of their union beyond what we've been able to negotiate for our members, extensive health care, for additional 30 days, so 60 days of healthcare. But beyond that, what happens if they get sick?
All right, Kyle, we're going to pick up that question and
Sure.
get back to you in a minute. Let me introduce Marielena Hincapié, who is the Executive Director of the National Immigration Law Center Immigrant Justice Fund. Marielena, thank you so much for being with us.
Thank you, Senator Sanders. Thank you for your leadership and for amplifying what's actually happening to immigrant communities across the nation. And again, my heart also goes out to you, Perla. Thank you for your courage, for your tenacity, and for being here and sharing your family story as someone who has lost my mother as well 20 years ago. I know the pain that you're going through. And Brother Kyle, thank you for your leadership, for all of your members who are also on the front lines. As you mentioned, Senator Sanders, at the beginning, right, our health and well-being is interconnected. If nothing else, what we're learning in this moment is how interdependent we are as a human race. We need to ensure that everyone, regardless of where we were born or how much money we have, has access to COVID-19 testing, to the healthcare, the treatment, and the economic relief when people need it. This public health crisis has exposed the pre-existing fractures in our society, ranging from the weak health and safety net system to the immigration system that has marginalized millions of low-income immigrants, to the labor and economic systems that have historically excluded communities of color. And these racialized systems of inequity are threatening our collective health, safety, and ability to thrive during this global pandemic. As you said, we're only going to get through this crisis if we come together and take care of everyone. Like Perla, there are about 202,500 DACA recipients that are working to protect the health and safety of all Americans as we confront COVID-19. There are 29,000 of them who are healthcare workers. Our country is on a daily basis recognizing the role of essential workers, and immigrants are part of those essential workers. They're included, for example, 29% of physicians in the United States are immigrants, 22% are nursing assistants, 38% are home health aides. In Tennessee, our partners at the Tennessee Immigrant and Refugee Coalition have shared with us that immigrant workers in the meatpacking industry are being pressured to come to work despite the fact that they're showing symptoms of COVID-19. They're being punished for missing a day of work or not having any sick leave provided to them. They're actually getting financial incentives for not missing a day of work and being encouraged to come to work sick. That puts all of us at risk. When politicians like Trump exclude immigrants, when Congress members exclude immigrants, they're actually endangering all of us. Immigrants have to be included in any legislative relief efforts. Immigrants and people of color are among the hardest hit by this virus. And as Brother Kyle said, this virus does not discriminate based on papers, race, class, language, or age. We need millions of working families to be receiving that same economic relief because of a family member's immigration status. That should not be the case. As Perla shared, at this moment, Congress in the recent relief packages that they provided excluded those workers, those families. 85% of immigrant families live in a mixed status family. What Trump is doing is dividing Americans by race, by class, and birthplace, and using immigrants as a political weapon to distract from his failure to protect American people from this pandemic and this economic crisis.
Marielena, let me just jump in and ask you to amplify on one issue. If you're in a mixed family, if you like, where one of the people may not even be undocumented, may have immigrant legal status,
Right.
Are you eligible for the $1,200? Are you eligible for the small business program?
You are not, unfortunately. What Congress has done is said, and this is in the last relief package in the CARE Act, is that everybody, in order to get the $1,200 tax rebate, you have to have a Social Security number. So those immigrants, for example, that are actually paying taxes with an IRS-issued individual tax ID number, the ITIN number, even they are not eligible for that tax rebate. And this is what's so cruel. As you mentioned at the beginning, I mean, undocumented immigrants, Senator Sanders, you know very well, are contributing $12 to $13 billion a year to our Social Security system. They're paying taxes at the federal, state, and local level, yet they're not being recognized as Americans. They're not being recognized for the essential role that they're playing in this moment.
So in other words, if an undocumented person loses his or her job, they're not going to go file for unemployment?
Absolutely right. They are excluded from unemployment insurance. And in fact, one of the things that we're calling on everyone in the country right now to, as Congress comes back from recess, to call your senators and your representatives of Congress, ensure that immigrants, because they're playing such an essential role, that they're recognized for the work that they're doing and they be covered, that they get the COVID-19 testing, treatment, rehab, any of that care, that comes regardless of immigration status or economic status, right? As Perla was just saying, her father was afraid to seek care because he was afraid he wouldn't be able to pay for it, or because of the fear of public charge. None of us should be excluded from this care. None of us should be excluded from those tax rebates. All of us are hurting. And when Congress or any policymakers, including Trump, exclude immigrants from these programs, they're hurting all of us.
Perla, let me get back to you for a moment. You mentioned that family members, your family members, hesitated to go to the hospital, hesitate to go to the doctor. And people in your community hesitate. It is a financial issue, which you've indicated. Hard to believe that when somebody is fighting for her life, the communication you get from the hospital is about how much money you owe, not about how the patient is doing, but that's the system that we have. Let me ask you a general question. Why do people in the undocumented community hesitate to go to a doctor, hesitate to go to a hospital?
Right. I believe I'm a community organizer and I continue to work right now. That is what I do. And when I do reach out to my community as of right now, and we try to make sure, working with Make the Road, we try to make sure, how are you doing? How is your family? Because a lot of my brothers and sisters don't even know what certain help is out there, or and this is what it comes to. I have my husband who's sick, and I'm like, and I'll ask them, why haven't you contacted the emergency room? Like, why? Like, what's stopping us from going? And it's the same story. They're afraid. They don't know if once you go in how you're going to come out. Some rather stay with their families, and then they're going to eventually at least get their last goodbyes with them. And I've heard stories from my own community members talking about we're afraid that if there isn't a chance for them to help us, but my family, since a lot of us don't have insurance, a lot of us are going to leave our family with just a large bill. And it's devastating that our mixed immigration status families feel this way, and that it's hitting us. This crisis is hitting us, but it excludes us. And working alongside with the community, and I hear the stories, it's really heartbreaking. I understand what they're going through because it's happening to us too. But
Perla, let me ask you this also, above and beyond healthcare crisis. Somebody loses their job, and you've talked about family members who lost your job. Often these jobs don't pay a whole lot of money to begin with. People don't have a lot of money in savings. So what are people doing when they're losing their jobs and they're not getting any federal help? What happens to the family then?
well, when I speak to my community and they're giving me feedback as what they are doing, they're kind of reaching out because they trust more organizations like Make the Road, where they know that they're not going to be affected with public charge, and they know that there are organizations that are going to help them and provide them with food or a little bit of income. And these are the organizations that our community is reaching out to. They don't want to deal with the government because they know they're going to be rejected. And under the Trump administration, they're just very afraid.
So there is that fear having to do with the fact that if I'm undocumented and I go to some governmental agency, that the word may get out that I'm undocumented and ICE may be knocking at my door? Is that part of the fear?
Yes, that is absolutely correct. It continues. And with the COVID-19 now hitting us, we continue to be afraid. Our brothers and sisters are continuing to maybe not even want to answer certain phone calls, or it's anything. And it doesn't have, they're still being afraid to getting information from certain departments because they know that in the future, they might get public charge.
Kyle, if I'm a member of your union, if I'm a janitor or whatever, and I lose my job, I'm furloughed, am I losing my health insurance as well?
Yes, eventually. We've been able to negotiate with our industry an extension of healthcare for 60 days beyond the point in which they lose their employment. But after that, they don't have health coverage. And what this COVID-19 has highlighted for us is something that we already knew to be true, is that, immigrants and people of color have been denied, this adequate care and treatment in their communities for years. And so we have to really figure out how to implement proven solutions that address the underlying issues that create these type of problems. We need to make sure that there's paid time to recover for all workers, regardless of status. We have to make sure that there's access for all workers and people for health care, regardless of status. And we have to make sure that that their work gives them a return that allows them to support their families. We have to look to alternative solutions beyond the government, beyond the national government, because we have to look into our states now to see how we can help protect those undocumented populations in our states. And we have to look to our states for those solutions, because we're not going to get it from Washington under this Trump administration. And so these are people who are suffering every day, and it's compounded by the fact that they're undocumented, and it's just shameful that this country allows it to happen.
Kyle, are your workers who are, when they apply for unemployment, are they getting processed in a reasonably quick time, or are they having difficulty getting those checks?
I can't speak for the majority of the workers that had to apply. I've heard that there's been some delays in getting the unemployment, processing the unemployment applications. But beyond that, those are workers who are entitled to it. What do we do about those undocumented workers who are not entitled to it? You asked the right question. What happens to those families? What happens to those workers? We have to find solutions in our states, too, that address those issues, because we cannot leave anyone behind. An injustice to one is injustice to all of us. An infection in this state to one is an infection to everyone. Mm-hmm. And so we have to make sure that we protect the most vulnerable folks in our communities, and we have to do it now.
Marielena, what do you suspect is behind the Trump's administration's efforts to be so cruel and so divisive? There is a political goal in mind, I suspect here. This is not just cruelty. It is an appeal to certain people in this country. Do you want to elaborate on that, or disagree, or whatever?
Sure, I'll start with that. And I think public charge is the perfect example of that, as Perla was raising, right? The public charge rule is actually having a harmful impact on our collective health and well-being. The fact that people are afraid to seek medical care because they may be denied a green card in the future is actually putting us all at risk, not just immigrant families. But what's really behind public charge is actually what's behind the Trump agenda as a whole. It's Stephen Miller, it's Stephen Bannon, right? Their approach is to try to slow down the demographic shift in this country and to basically change the way that we look like as Americans, right? To change the complexion of the United States, to make the United States a country that is only for the white and the wealthy. And that is at the core of this anti-immigrant agenda. We need to understand that Trump is using racism and xenophobia specifically to divide and distract us from his lack of leadership. And, when we look at the number of people that have died from COVID-19, when we look at the fact that 26 million Americans have lost their jobs, none of this has to happen. But Trump is constantly going to scapegoat immigrants, as we saw with his executive order just last week, trying to ban and stop immigration in the future, supposedly because he wanted to protect American jobs, when he made an exception for EB-5 investors, right? Making an exception for wealthy immigrants to come and invest in his hotels tells us what this is really about. It's about race, and it's about color, and it's about his effort to change the future of our nation and to disenfranchise communities of color, including future citizens, future voters who are currently here, like Perla's family, like people in my family, like Kyle's members.
All right, we got some questions here. Let me throw them out and we'll go from there. David Lawson asks, do we know how many undocumented Americans have been infected with or died from COVID-19? Marielena, do you have any, have we seen any numbers on this, or
I have
this is hard information to come up with?
Exactly. That's right, Senator Sanders. We have not. I mean, I'll ask our team to take a look and see what we find. But you know, for the very same reason, right, is that when people are afraid to seek medical care, what's happening is they're likely to pass away at home, is more likely, or they're coming forward and unable to share, you know, what their immigration status.
You know, as Kyle and Perla mentioned earlier, a lot of these low-income workers are now putting their lives on the line every single day. So they don't earn much money, and yet I would suspect they are coming down with the virus at higher numbers than many other groups in our society. Is that a fair assumption?
I'm not sure.
Perla, do you want to?
I'm not sure if it's a fair assumption, but what I can say is that there's obviously inequities with that population who do contract the virus, that they have way less options at healthy outcomes than anyone else, and that's the shame of it. We don't have numbers, and I'd be interested in knowing. But to your other question, it's like the messaging that's coming out of the White House is divisive. It's not about uniting a nation. It's not about lifting up all workers, all people in this country. His whole messaging is around make America great again. But to who's that? Who's he speaking to? He's certainly not speaking to the undocumented immigrants in the communities that I live in. They're not talking to the Black and brown people who are struggling every day under his policies. So who is it that he's talking to? It's certainly not the people that I represent every day. And his divisiveness, and thank God that I'm in a union, that we understand the value of standing together and being united. Whether you're white, Black, brown, who you love or who you pray to, doesn't matter. We understand that workers all need to be protected and that we're all trying to rise together. And so that's the message that should be coming from the White House, and not a message of division.
It is hard to believe, isn't it, that in the midst of this terrible pandemic, this racism and xenophobia and divisiveness doesn't stop from the White House. You would think they might take a halt for a few months, but apparently not. All right, we got a question here from Paulo Ferreira. He writes, undocumented immigrants were working and many of them filed income taxes. Why don't they have any financial relief from the government? Marielena?
Sure. Paulo, that's a great question. And that is exactly the question we're asking. And we call on you and everybody who's watching tonight to call on your members of Congress and ensure that they recognize immigrants who are taxpayers and that they get the coverage and the support that they need, both from a health and economic level. There's a particular bill by Senator Hirono and Representative Chu that's pending in the Congress, which would do all of these things. It would provide access to these rebates and to the economic relief for everybody, including those with Social Security numbers or with an ITIN. It would also expand Medicaid, emergency Medicaid for healthcare access during, including COVID-19 testing and treatment. It would also halt the public charge wealth test that Perla and I were talking about. And we are also, the other provision of that bill is that it would extend automatically the work authorization for people like Perla with DACA or temporary protected status so that they can continue working, helping to support themselves and their families.
All right, we're going to do our best in the Senate to fight for those principles, and we'll work with our friends in the House as well. All right, we got a question here from Freddie Chang, and Freddie writes, in what ways does immigrant status impact people's ability to seek medical care? And we touched on that a moment ago, but let me throw it to Marielena. So if I'm undocumented, I'm not feeling all that great. Why do I hesitate going to a doctor or a hospital, even above and beyond money?
Yeah. So I think the two main reasons, and Perla spoke to this earlier, one is the overall anti-immigrant rhetoric has sent a message to immigrants, regardless of status. We even have people who are U.S. citizens who have family members that are undocumented that are afraid that if they go seek medical care, that they could be detained and placed into deportation proceedings, or that they will be denied the ability to get a green card, that they'll get blocked from remaining in the country with their family, and their families will be separated. So that fear, just imagine wanting to be an American so badly that you would make life and health decisions based on that because you're afraid and don't want to be separated from your family. And now with COVID-19, we're seeing the impact of those anti-immigrant laws. They actually endanger all of us, not just immigrants.
Right, because if that individual has COVID-19, doesn't get treated, and goes to work, hey, you can be the next person coming down with the pandemic then.
That's right.
Anybody else want to comment on that?
Yeah.
Go ahead, Perla.
Perla, why don't you go, and then Kyle, you go.
Yeah, I would just like to add a little bit to what she just said. Absolutely. I had never heard of when we go to the emergency room or to the hospital that, that's the first question that they ask our community members. Okay, what's your legal status? And I will say that did happen to us, and it was absurd, where my main concern is I haven't heard from the doctor, but you're concerned about her legal status. It was absolutely, it was unbelievable. She was like, does she have a green card? Is she a U.S. citizen? I've never heard of such a thing, but I don't know what the process is or why their excuse of COVID-19 continues to be used as the excuse, that they're making these questions or making my community very uncomfortable. And when I reach out and I speak to my fellow members, they're getting questions like this. Of course, we're not going to want to go to the emergency room. Why does that matter? Are you not going to help me if I give you my legal status? At the moment, I can't breathe is the answer. I need help. Right. And I just wanted to mention that. Thank you.
Kyle, pick up on that.
Okay.
But also get to the issue of the need for health care for all as a human right. Now, as many of you know, I think that a system, and it may impact your people, Kyle, when they lose their jobs. I know you fought to get them a couple of months extension of their health care, but there is a possibility if this thing goes on long enough that they're going to lose their health care. Right. What do we think about a system, a healthcare system that ties your health care to your job, especially at a time when 26 million people in the last 5 weeks have lost their jobs, which means many millions of people have lost their health care as well? Kyle, you want to take a shot at that?
Well, first, I want to thank you, Senator, for being a champion on that issue. I would then further say that it's deplorable that any working person in this country has to go without affordable quality health care, access to affordable quality health care. We have to demand, and also to Perla's point, we have to demand that there's treatment and testing for all workers, for everyone, regardless of their immigration status, for the color of their skin, whether their income status. It shouldn't be for the wealthy or just the elite. It has to be for everyone. And this,
Kyle, let me jump in and ask you this question.
Sure. Mm-hmm.
All right, there's a lot of talk about reopening the economy, bringing people back to work. Are you comfortable as a union leader in having your people go back to a job and be around other people without knowing whether or not some of those people may have the virus?
Well, I tell you, it's scary. It's a scary proposition for all workers. Our workers, for the most part, are still going to work. They're keeping schools clean so that they're ready for the opening for kids to return. They're keeping residential housing clean and in good repair so that people who are sheltered in place have a safe place to live. They're guarding homeless shelters, security officers, and every day they risk themselves to this pandemic.
Kyle, have your members been able to get the testing that they need?
We have access. The members who are working have access to health care because of our union agreements. All workers should have access to health care.
Have many of them gotten tests? Do you know?
I don't know that. I don't have the figures or the statistics to give to you, Bernie. But I would say to you that regardless of whether they had tests or not had tests, everyone should have access to it, right? Everyone should be able to have.
I would go further than that. I would say that if you're going to go to work, I think you have a right to know whether anybody else working with you has the virus or not.
I would agree with you.
Okay. Thoughts on that, Marielena?
Yeah, I mean, Senator Sanders, again, thank you for your leadership on this. I mean, we believe that, at the National Immigration Law Center Immigrant Justice Fund, that every human being deserves the freedom to thrive. And that means it includes the freedom to have access to health and safety net programs, right? We need to make sure that everyone is able to get the care that they need to live a healthy life. Again, if, like my mother used to say, sin salud no tenemos nada. Without health, we don't have anything, right? That is a human right that we're talking about, and which is why the stakes in November couldn't be clearer, right? Medical experts and scientists have warned us about COVID-19 for months before Trump took time, and actually he's been rejecting expert advice. And this notion that he's telling people to go liberate their states and fight to go back to work is endangering all of us. And so we need a president who takes the responsibility, who listens to experts, and who unites people based on our humanity, our shared humanity, our dignity, not simply dividing us based on race and class and country of birth. And we need a president who can ensure that all Americans, including immigrants who are playing such an essential role right now, can be safe, can be healthy, and can thrive and get access to the healthcare that they need.
It's funny, you mentioned that in Spanish, without good health, nothing matters. Believe me, I think in every language in the world, it comes out exactly the same. I think my grandparents were saying that in Yiddish.
That's right.
Let me go to a question now from Maria Jose Luna, and I'll direct this to Perla because I think it may be a little personal there. Maria writes, how do we support college students who are in DACA, who are undocumented with no federal funds being allowed for them? Perla, you want to take a shot at that?
Right, yeah. Thank you, Maria, for that question. I think the best we can do, coming closer to every day, every week, trying to get an answer from the Supreme Court about us documented. I think the best is the support to come together, united, to find, if you do have an organization, if you don't, please find one. It's super helpful to be together and to get as much as support as you can, because we don't have the financial support. We don't have financial, but we can find a way. When we organize, we win. And that's I think one of the best advices I can give you right now.
Okay. We got a question here. Maybe this is addressed to me. This is from Molly Jean. Why is it so hard to get politicians in DC to talk about the undocumented community? I think the reason is that Trump has done a very effective and horrific job in dividing us up and in pitting one group of people against another. So instead of reaching out with our humanity, with compassion, with solidarity, what Trump, who is busy giving tax breaks to billionaires, is doing is saying, do you really want to support the undocumented? Neglecting the fact, as we have discussed tonight, that the undocumented who are working are pouring billions of dollars into the federal government. So Trump's demagoguery is nothing new. That's what demagogues always do. And whether they're going after African Americans or Jews or gays or Latinos, you name the group, it is always taking people's anger and frustration and turning it against a minority. And today that minority, in a significant degree, is the undocumented. Marielena, what do you think?
I think that's absolutely right, Senator Sanders. And I think that this is a moment for leadership. And what we're finding is that we need to ensure that we're holding not just President Trump accountable, but any member of Congress that is voting to exclude immigrants is actually endangering all of us. And so this is a time for courage. This is a time for courage, like people like Perla, and it's a time for politicians both on Federal Hill, on Capitol Hill, as well as at state and local governments as well,
And it's
to make sure that they're including.
It's a time to remember the need for comprehensive immigration reform, yeah?
Yes, I mean, I think it's more than that, though, right? We're talking about healthcare. It's about ensuring that we both provide legal status and recognize the essential role that immigrants are playing, but also to ensure that people are getting access to healthcare, to safety net programs, to the labor and employment rights that Kyle was talking about earlier, right? We need a broad approach to ensuring that immigrants are part of our communities. They're part of our families. They're our co-workers. They're our students. They're our teachers, right?
They're our agricultural workers.
Absolutely.
You know, I think tonight we've been focused a little bit more on urban life, but let us remember that most of the people who pick our crops are undocumented or at least immigrant status.
Absolutely. Our farm workers, our meat packing, our poultry plants, right? And this is not just New York and LA. We're talking about Tennessee. We're talking about Nebraska, Kansas, all over the nation.
And we're talking about those workers in the meat packing houses who are coming down by the hundreds.
That's right.
With the virus. All right. Here's a question from Zoe F. What can Congress do to ensure undocumented immigrants living in America are as taken care of during the COVID pandemic as offshore cruise ship companies? In other words, Trump and his friends have bailed out Carnival and other large cruise ships, and yet they have turned their backs on the undocumented, despite the fact, by the way, that many of these large cruise ship companies pay virtually nothing in federal taxes. So I think what we need to do, let me answer that question, is what we need to do is stand together as a people, understand we're all in this together, and that we need policies that protect all of us, not just the well-connected and the well-off. And among other things, let me just tell you very briefly about some of what my office is working on with other members of Congress. And that is while we fight for Medicare for all and end the embarrassment of being the only major country on earth not to guarantee health care to all, and by all, I mean all, including the undocumented. That while we wage that fight, we understand that at least in the midst of this terrible healthcare crisis, all people have the right to go to a doctor, have the right to go to the hospital and not worry about how they're going to pay the bill, because Medicare will either pay for it or supplement the private insurance that they have, so that no family has to go through what Perla's family has gone through. We want to make sure that, as we have discussed tonight, that the benefits that are out there are available to all of our people. Extending unemployment benefits, available to all. That $1,200 check, available to all. Small business loans and grants, available to all. That we make sure that in America, when so many of our people are going hungry, that all people have the food they need to survive this crisis with dignity. Anybody want to add anything to that?
I would just jump in real quick and just say that it's important also that we keep people working and keep paying in their homes. And, we have to make sure that, contracted workers, which are documented, undocumented workers, continue to receive income in this moment. And so in this next bailout, we want to make sure that people will continue to receive income and salaries because that's the way we protect them also, that they don't have to worry about applying for unemployment, that they can continue to receive a paycheck every week.
And that's exactly the legislation, as you know, that we're fighting for right now. And it is what I want everybody to know this. That provision was put into the last Corona bill, Corona 3, for airline industry workers. And that is, as you may know, 2 million workers in the airline industry today continue to receive their paycheck and their health care benefits, whether they're working or not. Legislation that I am working on with a number of other senators would do that for every worker in America.
Yes.
You continue to get your paycheck. That makes sense to you, Kyle?
Yes, sir. Thank you for championing the last one.
Okay. Frank Harper writes, how would the cost for COVID be covered for undocumented immigrants under Medicare for all? Thanks for the question, Frank. Let me answer that. Please understand that currently, as a nation, we are now spending twice as much per capita on healthcare as do the people of any other nation. We pay for it in a very convoluted way. We pay for it through premiums. We pay, our employers pay. We pay for it through co-payments when we go into a doctor's office. We pay for it through taxes for Medicare, Medicaid, and the Veterans Administration. We pay for it through the highest prices in the world for prescription drugs. We pay for it through out-of-pocket expenses. Add it all up, we're spending about $11,000 for every man, woman, and child, by far the highest price in the world for healthcare. The way we would pay for the undocumented and everybody else is through a progressive tax system, which means, by the way, that it is fully paid for, it is comprehensive, and you don't have to be filling out a dozen forms every time you go to the hospital. You don't have to get the calls that Perla's family got, wondering how you're going to pay the bill, because it is already paid out of the general tax base. And we can do that and cut the cost of healthcare, which is now some $12,000 for a working family every year, the average family. We can cut that significantly because we end the profiteering of the drug companies and the insurance companies. We end the incredible amount of administrative wastes. When somebody in a hospital is calling Perla up and driving the family to despair, wondering how the bill is going to be paid, that person is being paid for through healthcare dollars. It makes a lot more sense for somebody simply to walk in, here's my ID card, you get all the healthcare you need. You don't need to waste hundreds of billions of dollars on administration. You know, whether you're in the right network or not, or whether this procedure is covered 80% or 63%. All of that administrative stuff ends up wasting hundreds of billions of dollars that should go into the provision of healthcare. That is my view, and I'm sticking to it. Marielena, you agree?
I do completely agree. And in the short term, on COVID-19, one of the demands right now is that the bill that's pending in Congress from Senator Hirono and Representative Chu would provide emergency Medicaid to pay at the very, very least, for that COVID-19 testing and the medical care, like for Perla's mom.
Well, that is a very minimum. I think we have to go a little bit further than that. But can you imagine how insane it is that somebody who's sick can't afford to get the test, doesn't get the test, they spread the disease? Who benefits from that?
That's right.
All right. I think we've run out of questions here. Who wants to wrap it up? Perla, what do you think? We've covered a lot of territory tonight. And thank you very much. Thank you for, I get around the country a lot. And sometimes it gets a little bit depressing to deal with the White House and all that stuff. But you know what keeps me and a lot of us older folks going? People like you. We have a fantastic younger generation of intelligent, hardworking, compassionate young people who want a very, very different world. So, Perla, what do you think?
Yeah, thank you so much for that. That's very kind. And I want to add a little bit, just jumping back to, of course, I do think that we absolutely need a recovery for all, one that specifically puts everyone, making sure that everyone has access to health care, everything that they need. And without the huge hospital bills, absolutely. My mother, we already lost my mother. I understand that. And I know nothing's going to bring her back. But the least that our elected officials could do is respond with a real recovery for all that treats us with dignity, respect that we all need. And I just want to thank you for the opportunity to hear us out. And I know I mentioned a couple about a lot of the other stories that I've heard from our community. Thank you. Gracias, Tia Bernie.
And thank you very much. And thank you for the great work you're doing and your willingness.
Mother.
Your willingness. Is that your mother right behind you there?
That's my beautiful mom.
Yes.
Yeah. Thank
Thank you for sharing your family story. Kyle, I think, is like yourself, I've been supporting and working with trade unions my whole life. And the essence of what the trade union movement is solidarity, is it not?
That's correct. Ronnie, we need unions for all. I mean, everyone should have the benefit of a union to have collective bargaining and representation, which would answer a lot of these issues in which we're speaking of today. It's just unfathomable that we have to be in one of the richest countries in the world and not have health care for all. To be in one of the richest countries in all and still use the term the working poor. How ridiculous is that? To be in one of the richest countries for all and have people afraid to seek out a health or resources or health care because of their status. It is ridiculous. And I think that it humbles me to be on this podcast with such incredible champions on these issues and that you have put together this evening. And I hope that this message goes out loud and clear that we cannot no longer tolerate another term of this insanity. This country cannot afford to another 4 years. We can't afford another damn day of this insanity, much less another 4 years. And so I hope this message is going out loud and clear. Thank you for creating this platform because it's so important to those people who are the underserved, the marginalized, that we stand up, we stand together, fight back, fight forward, and win for all people, all working people.
Well, Kyle, thank you for being with us tonight, and thank you for your great work with the union. And know that I look forward to working with you and the other union leaders in this country to significantly grow the trade union movement, because there are many workers out there who would like to become union members, but because of employer opposition, illegal opposition often, are unable to do so. So let's work together to bring millions more people into the union movement so that they have the kind of representation and the benefits and the decent wages that you have fought for with your members.
I grew up in the labor movement. I know what it means to working families and to Black and brown and poor, low-income communities. So thank you so much.
Thank you. Marielena, your thoughts.
Thank you, Senator Sanders. First of all, for the invitation to be here with you and for your leadership, to Perla and to Brother Kyle for your leadership and your courage. When I think about what's at stake in November, it's about lives. It's about our health, our collective well-being. This man is absolutely dangerous. Black and brown people, particularly immigrants, are feeling the brunt of this. We cannot have Trump in the office for a single more day. And until then, I heard one of the questions from one of the callers ask about what could be done. And one of the things that we all can do is make sure that we are registering to vote, that we are going to vote and voting for those people like Perla who currently cannot yet vote, right? Our lives depend on it. Our health depends on it. We must come together. We must do better as a nation. This is who we are becoming. We're at a fork in the road right now. We get to choose the kind of country we want to be. Is it one where everyone, our shared dignity, our shared humanity is respected, and where our laws can actually be just, where we can have a just recovery, where we can have health as a human right for every single one of us? And that is what I believe in, and I'm really hopeful that we can all come together and make sure that we do it because our lives depend on it.
Well, very well said. And, let me just conclude by saying what I think most of the viewers and certainly the panelists know. We are the wealthiest country, not only in the world today, but in the history of the world. And yet tonight, you got 500,000 people who are homeless. Well, Jeff Bezos, by the way, in the last 5 weeks, saw his wealth increase by $45 billion. Guy who's head of Amazon. All right? You got millions of people don't have enough food in the pantry, and yet the very, very rich are getting much richer. You got half of our people in this country, Kyle referred to this, who are living paycheck to paycheck. And that paycheck doesn't come in, they get furloughed, they get laid off. How do they survive? You got 87 million people before the economic meltdown, who had no health insurance, who are underinsured. And that number has increased by tens and tens of millions. You got people all over this country, by the millions, who are scared to death they may get evicted because they don't have enough money to pay their rent because they lost their job, or they're going to lose their homes or lose their cars.
Mm-hmm.
So I think what we have got to do as a people is keep our eyes on the prize. And what tonight is about is not letting Trump or anybody else divide us up. I am the proud son of an immigrant. My father came from Poland. And we cannot allow this xenophobia and this ability of Trump, his tendency to try to divide us up, whether it's the color of our skin or our sexual orientation or where we were born. What the trade union movement has always been about, solidarity, understanding that when you come together, we stand together, we can win. And that has been what every strong social movement has ever believed in and have been successful because of that fact. So in this very difficult moment in American history, an unprecedented moment, do not allow Trump and his friends to divide us up. Whether you're undocumented or you're documented, or whether you're black or white or green or whatever you may be. You got to feed your kids. You got to go to the doctor when you're sick. You need a roof over your head. You want your kid to get a decent education. Let us stand together as human beings and create a nation and a world which works for all of us, not just the wealthy and the powerful. And on that note, let me thank all of you very much for all the work that you are doing and for being with me tonight. Appreciate it very much. Good night, everybody.
Good night.